Question 1. Risk assessment procedures indicate that a new linear accelerator accessory designed to enhance dose conformity may introduce novel scatter radiation patterns and potentially alter beam characteristics. Which of the following represents the most appropriate course of action to ensure compliance with American College of Radiology Radiation Oncology Accreditation standards for radiation safety and protection? Option A. Implement the accessory for patient treatments while deferring the formal radiation safety review until after a sufficient number of patients have been treated and initial outcomes are observed. Option B. Conduct a comprehensive, documented radiation safety evaluation by the Radiation Safety Officer and Radiation Oncology Committee, including independent verification of the accessory's performance and potential risks prior to any clinical use. Option C. Proceed with clinical implementation of the accessory immediately, relying on the vendor's assurances of safety and planning to address any identified safety concerns retrospectively. Option D. Adopt the accessory based on positive anecdotal reports from other facilities, assuming its safety profile is comparable to existing technologies without requiring a site-specific risk assessment. The correct answer is B. Conduct a comprehensive, documented radiation safety evaluation by the Radiation Safety Officer and Radiation Oncology Committee, including independent verification of the accessory's performance and potential risks prior to any clinical use. Explanation. Scenario analysis. This scenario presents a common challenge in radiation oncology accreditation, where a new, potentially beneficial technology is introduced. The professional challenge lies in balancing the imperative to provide state-of-the-art care with the absolute priority of patient and staff safety, as mandated by ACR Radiation Oncology Accreditation Guidelines. The decision requires a thorough understanding of radiation physics, clinical efficacy, and regulatory compliance, moving beyond simple adherence to established protocols to proactive risk management. Correct approach analysis. The correct approach involves a comprehensive, multidisciplinary evaluation that directly addresses the ACR's emphasis on quality and safety. This includes a detailed technical review of the new technology's radiation output, shielding requirements, and potential for scatter radiation. Crucially, it necessitates a thorough risk assessment specific to the proposed clinical application, considering patient positioning, treatment planning, and potential for unintended dose delivery. This evaluation must be documented and reviewed by the Radiation Safety Officer, RSO, and the Radiation Oncology Committee, ROC, aligning with ACR requirements for oversight and quality assurance. The process should also include staff training on the new technology and its associated safety protocols, ensuring competency and minimizing human error. This systematic, evidence-based approach ensures that patient safety is paramount while exploring advancements that could improve treatment outcomes, fulfilling the core tenets of ACR accreditation. Incorrect approaches analysis. Implementing the new technology without a formal, documented risk assessment by the RSO and ROC is a significant regulatory failure. ACR accreditation mandates robust quality assurance and safety oversight, which would be bypassed by such an approach. This failure to involve designated safety personnel and committees directly contravenes the spirit and letter of accreditation standards, which are designed to prevent harm. Adopting the technology based solely on vendor claims or anecdotal evidence from other institutions, without independent verification of its safety and efficacy within the accredited facility's specific context, represents a failure in due diligence. ACR accreditation requires facilities to demonstrate that all equipment and procedures meet established safety standards, not just that they are commercially available. This approach risks introducing unmitigated hazards. Proceeding with implementation while deferring the radiation safety review until after patient treatments have begun is a critical ethical and regulatory lapse. ACR accreditation emphasizes proactive safety measures. Delaying safety assessments until after potential exposure has occurred is a reactive and unacceptable approach that prioritizes expediency over patient and staff well-being, directly violating the principles of radiation protection and accreditation standards. Professional reasoning. Professionals facing such decisions should utilize a structured risk management framework. This begins with identifying the potential hazard, new technology, and its radiation characteristics. Next, assess the likelihood and severity of potential harm to patients and staff. This assessment must be informed by technical data, clinical experience, and regulatory requirements. Based on this assessment, appropriate control measures, e.g., shielding, procedural changes, training are identified and implemented. Finally, a system for ongoing monitoring and review is established to ensure the continued effectiveness of these controls. In the context of ACR accreditation, this framework must be integrated with the facility's established quality assurance and radiation safety programs, involving the RSO and ROC at every critical decision point. Question 2. Implementation of a new institutional policy requires radiation oncologists, medical physicists, and dosimetrists to explicitly justify dose constraints for critical organs and tumor control in all treatment plans based on established radiobiological models and dose-response data. What is the most appropriate approach to ensure compliance and support accreditation? Option A. Rely on the existing treatment planning system's default dose constraints, assuming they are based on sound radiobiological principles without further verification or documentation. Option B. Focus primarily on the technical aspects of dose delivery and image guidance, with radiobiological justification of dose constraints being a secondary consideration, addressed only if specifically questioned during accreditation. Option C. Encourage individual team members to independently research and apply their preferred radiobiological principles and data when setting dose constraints, fostering individual expertise. Option D. Develop and implement a standardized protocol that outlines the specific radiobiological models and dose-response data to be referenced for common tumor sites and critical organs, with a mandatory review process for all treatment plans to ensure adherence. The correct answer is D. Develop and implement a standardized protocol that outlines the specific radiobiological models and dose-response data to be referenced for common tumor sites and critical organs, with a mandatory review process for all treatment plans to ensure adherence. Explanation. Scenario analysis. This scenario presents a common implementation challenge in radiation oncology accreditation, translating fundamental radiobiology principles into consistent, safe, and effective clinical practice. The challenge lies in ensuring that the understanding of concepts like the linear no-threshold model, dose-response relationships, and tissue sensitivity is not merely theoretical, but actively informs daily treatment planning and delivery decisions. Accreditation requires demonstrable adherence to these principles, necessitating robust protocols and ongoing staff education. The difficulty arises from the need to bridge the gap between scientific knowledge and practical application, especially when dealing with variations in patient anatomy, tumor types, and treatment techniques. Correct approach analysis. The correct approach involves establishing a comprehensive, documented protocol for integrating radiobiological considerations into the treatment planning process. This protocol should mandate that treatment planning systems are calibrated to reflect known radiobiological models, and that dose constraints are derived from established dose-response data for critical organs and tumor control. Furthermore, it requires regular review and updates to these protocols based on evolving scientific understanding and clinical outcomes. This systematic integration ensures that treatment decisions are grounded in radiobiological evidence, directly supporting the ACR's emphasis on evidence-based practice and patient safety, which are core tenets of radiation oncology accreditation. This approach demonstrates a commitment to understanding and applying the biological effects of radiation to optimize therapeutic outcomes while minimizing toxicity. Incorrect approach is analysis. One incorrect approach is to rely solely on historical treatment plans or institutional best practices, without explicit validation against current radiobiological principles. This fails to meet accreditation standards because it lacks a systematic, evidence-based foundation. It risks perpetuating suboptimal or even unsafe practices if the historical basis was not rigorously derived from radiobiological data. Another incorrect approach is to delegate the interpretation and application of radiobiological principles solely to individual physicists or dosimetrists without a standardized institutional protocol or oversight. This leads to inconsistencies in treatment planning and can result in variations in dose delivery that are not biologically justified, potentially compromising patient care and failing to meet the systematic requirements of accreditation. A third incorrect approach is to focus on technological advancements in treatment delivery without a corresponding emphasis on the underlying radiobiological rationale for dose prescription. While advanced technology is important, Accreditation requires that its use is guided by a deep understanding of how radiation interacts with biological tissues to achieve therapeutic goals and avoid harm. Without this, technology can be misapplied, leading to unintended consequences. Professional reasoning. Professionals facing this challenge should adopt a systematic, evidence-based approach. This involves 1. Understanding the specific radiobiological principles relevant to the treatments being delivered. 2. Developing and documenting clear institutional protocols that translate these principles into actionable steps for treatment planning and delivery. 3. Ensuring that all staff involved in treatment planning and delivery are adequately trained on these protocols and the underlying radiobiology. 4. Establishing a process for regular review and update of protocols based on new scientific literature, clinical outcomes, and accreditation requirements. 5. Utilizing treatment planning systems and quality assurance procedures that are aligned with these radiobiological principles. This structured decision-making process ensures that patient care is optimized, safety is paramount, and the institution is prepared for accreditation by demonstrating a robust understanding and application of radiobiology. Question 3. Governance review demonstrates that during routine quality assurance checks for a linear accelerator, a medical physicist notes a subtle but consistent increase in the effective energy of the photon beam over several weeks, a phenomenon consistent with beam hardening. This observation raises questions about its potential impact on dose calculations and delivery accuracy. Option A. Document the observation as a minor physical anomaly and continue with standard treatment delivery, as beam hardening is a known physical effect that typically does not significantly impact clinical outcomes. Option B. Immediately recalibrate the linear accelerator's energy spectrum to counteract the observed beam hardening, assuming it is solely an equipment malfunction. Option C. Consult ACR accreditation guidelines and relevant physics literature to assess the clinical significance of beam hardening on dose distribution and treatment planning, and if indicated, perform further quantitative analysis and consider protocol adjustments. Option D. Implement immediate, unverified changes to the treatment planning system's dose calculation algorithms to compensate for the increased beam energy. The correct answer is C. Consult ACR accreditation guidelines and relevant physics literature to assess the clinical significance of beam hardening on dose distribution and treatment planning, and if indicated, perform further quantitative analysis and consider protocol adjustments. Explanation. Scenario analysis. This scenario presents a common challenge in radiation oncology accreditation, where a discrepancy arises between theoretical knowledge of radiation physics and its practical application in ensuring patient safety and treatment efficacy. The challenge lies in interpreting the implications of a specific physical phenomenon, e.g., beam hardening, on established treatment protocols and quality assurance procedures, requiring a nuanced understanding beyond simple recall of facts. The professional challenge is to identify the most appropriate course of action that upholds the ACR standards for radiation oncology, prioritizing patient well-being and the integrity of the treatment process. Correct approach analysis. The correct approach involves a systematic evaluation of the observed phenomenon within the context of established ACR guidelines and best practices for radiation physics. This requires understanding how beam hardening can affect dose distribution, potentially leading to under- or overdosage in specific regions of the patient. The best professional practice is to consult relevant ACR accreditation requirements, specifically those pertaining to quality assurance, equipment calibration, and treatment planning, to determine if the observed effect necessitates a modification of current protocols or further investigation. This approach ensures that any identified anomaly is addressed in a manner consistent with regulatory expectations and clinical standards, thereby safeguarding patient care. Incorrect approaches analysis. Ignoring the observation as a minor or insignificant physical effect represents a failure to adhere to the ACR's emphasis on rigorous quality assurance and a proactive approach to potential treatment deviations. This could lead to compromised treatment accuracy and patient harm, a direct violation of ethical and regulatory principles. Attributing the observation solely to equipment malfunction without a thorough physics-based investigation fails to acknowledge that beam hardening is a predictable physical phenomenon that may require adjustments to treatment planning or delivery parameters, not just equipment repair. This approach bypasses a critical step in understanding and mitigating the impact of the physics on the treatment. implementing immediate, unverified changes to treatment planning parameters based on a single observation, without consulting ACR guidelines or performing further analysis, risks introducing new errors and compromising treatment consistency. This demonstrates a lack of systematic problem-solving and adherence to established quality control processes. Professional reasoning. Professionals facing such a situation should employ a decision-making framework that prioritizes patient safety and regulatory compliance. This involves 1. Recognizing and documenting the observation. 2. Consulting relevant ACR accreditation standards and physics principles to understand the potential implications. 3. Performing a thorough physics-based analysis to quantify the effect and its impact on dose delivery. 4. Collaborating with qualified medical physicists and radiation oncologists to interpret the findings. 5. Implementing corrective actions, if necessary, in accordance with established protocols and ACR guidelines. 6. Documenting all steps and outcomes for future review and accreditation. Question 4. Investigation of a sudden, unexpected radiation alarm in the treatment planning area of a radiation oncology department, where a linear accelerator is undergoing routine maintenance, presents an immediate ethical and professional challenge. The alarm is audible and visible, but the source and extent of the potential radiation leak are not immediately apparent. The radiation oncology team is present, along with a few patients in the waiting area. What is the most appropriate immediate course of action? Option A. Inform all patients in the waiting area and their accompanying family members about the alarm and the potential for a radiation leak to ensure transparency. Option B. Immediately secure the area by closing doors and restricting access, then promptly notify the Radiation Safety Officer (RSO) and initiate the facility's established emergency response plan. Option C. Begin a thorough, independent assessment of the radiation source and potential exposure levels before informing anyone, to avoid causing unnecessary alarm. Option D. Assume the alarm is a malfunction and continue with scheduled patient treatments while monitoring the situation from a distance. The correct answer is B. Immediately secure the area by closing doors and restricting access, then promptly notify the Radiation Safety Officer (RSO) and initiate the facility's established emergency response plan. Explanation. Scenario analysis. This scenario presents a significant ethical and professional challenge due to the immediate need to balance patient safety, regulatory compliance, and the potential for panic or misinformation during an unexpected radiation incident. The radiation oncology team must act decisively and responsibly, adhering to established protocols while also managing the human element of fear and uncertainty. The pressure to contain the incident, protect staff and patients, and accurately report the event creates a complex decision-making environment. Correct approach analysis. The correct approach prioritizes immediate containment and notification, as mandated by ACR Radiation Oncology Accreditation Guidelines for emergency preparedness. Promptly securing the area and initiating the established emergency response plan ensures that the incident is managed according to best practices, minimizing further exposure and facilitating a controlled investigation. Contacting the Radiation Safety Officer, RSO, and relevant authorities is a critical step for regulatory compliance and expert guidance, preventing escalation and ensuring proper reporting procedures are followed. This approach reflects a commitment to patient and staff safety, adherence to accreditation standards, and responsible incident management. Incorrect approaches analysis. One incorrect approach involves delaying containment and notification to first assess the full extent of the incident independently. This failure to act swiftly violates the principle of immediate containment outlined in emergency preparedness standards, potentially allowing for further uncontrolled exposure and hindering the effectiveness of the official response. It also bypasses the crucial role of the RSO and regulatory bodies, which are essential for proper incident management and reporting. Another incorrect approach is to prioritize informing all potentially affected patients and their families before securing the area and notifying the RSO. While communication is important, premature and potentially unverified information can cause undue alarm and panic, complicating the emergency response. The immediate priority in a radiation incident is containment and expert assessment, followed by controlled communication. This approach risks compromising safety protocols and regulatory adherence. A third incorrect approach is to assume the incident is minor and can be handled solely by the immediate on-site staff without involving the RSO or external authorities. This underestimation of the potential risks and a failure to follow established reporting protocols are significant regulatory and ethical breaches. Accreditation standards require a clear chain of command and notification process for all radiation incidents, regardless of perceived severity, to ensure comprehensive safety and compliance. Professional reasoning. Professionals facing such a situation should employ a structured decision-making process that begins with immediate threat assessment and containment, followed by strict adherence to the facility's emergency response plan. This plan should clearly delineate roles, responsibilities, and communication pathways, including immediate notification of the RSO and relevant authorities. Transparency and accurate communication, once the situation is under control and verified, are also crucial. Professionals should rely on their training, established protocols, and the expertise of designated safety officers to navigate the complexities of radiation incidents, ensuring both patient and staff safety and regulatory compliance. Question 5. System analysis indicates that a patient diagnosed with locally advanced non-small cell lung cancer is being considered for a treatment plan involving concurrent chemoradiation followed by immunotherapy. The Radiation Oncology Department is preparing to initiate external beam radiation therapy. What is the most appropriate course of action for the Radiation Oncology team to ensure compliance with American College of Radiology Radiation Oncology Accreditation standards when integrating this combination therapy? Option A. Rely solely on published literature for managing combined modality treatments, without direct consultation with the treating medical oncologist to maintain objectivity in radiation planning. Option B. Proceed with the planned radiation therapy based on standard protocols for lung cancer, assuming the medical oncologist has addressed all systemic therapy considerations. Option C. Initiate radiation therapy immediately to avoid delaying treatment, and address any potential interactions with systemic therapies as they arise during the course of treatment. Option D. Conduct a thorough review of the specific chemotherapy agents and the proposed immunotherapy regimen, consulting with the medical oncology team to understand potential synergistic toxicities and adjust radiation planning and supportive care accordingly. The correct answer is B. Proceed with the planned radiation therapy based on standard protocols for lung cancer, assuming the medical oncologist has addressed all systemic therapy considerations. Explanation. Scenario analysis. This scenario presents a professional challenge due to the increasing complexity of cancer treatment, specifically the integration of radiation oncology with systemic therapies like chemotherapy and immunotherapy. The American College of Radiology, ACR, Radiation Oncology Accreditation Program, emphasizes the importance of a multidisciplinary approach and adherence to established standards for patient safety and treatment efficacy. When combining radiation with chemotherapy or immunotherapy, oncologists must carefully consider potential synergistic effects, additive toxicities, and the optimal sequencing and timing of these modalities. Accreditation requires demonstrating a robust understanding of these interactions and having protocols in place to manage them effectively, ensuring that patient care is evidence-based and coordinated across disciplines. Correct approach analysis. The correct approach involves a comprehensive, multidisciplinary evaluation of the patient's case, including a thorough review of the proposed chemotherapy or immunotherapy regimen, its known interactions with radiation, and the potential impact on radiation-induced toxicities. This approach aligns with ACR accreditation standards that mandate a coordinated care plan developed by a qualified team. It ensures that the radiation oncologist is fully informed about systemic treatments, allowing for appropriate adjustments to radiation dose, fractionation, and target volume to mitigate overlapping toxicities and optimize treatment outcomes. This collaborative process is essential for patient safety and reflects best professional practice in modern radiation oncology. Incorrect approaches analysis. One incorrect approach would be to proceed with radiation therapy without a detailed understanding of the concurrent chemotherapy or immunotherapy regimen and its potential interactions. This fails to meet ACR accreditation requirements for coordinated care and patient safety, as it ignores potential additive toxicities that could lead to severe adverse events or compromise treatment delivery. Ethically, it represents a failure to provide informed consent regarding the full spectrum of risks associated with combined modalities. Another incorrect approach would be to solely rely on the recommendations of the medical oncologist without independent radiation oncology input on the integration of radiation. While collaboration is key, the radiation oncologist has specialized knowledge regarding radiation physics, radiobiology, and the specific dosimetric and anatomical considerations that are critical when combining radiation with systemic agents. Ignoring this specialized expertise can lead to suboptimal treatment planning and increased risk of complications, violating ACR standards for comprehensive radiation oncology services. A third incorrect approach would be to assume that standard radiation protocols are sufficient when combined with novel immunotherapies without specific protocol review. Immunotherapies can have unique toxicity profiles, including immune-related adverse events that may be exacerbated by radiation. Failing to adapt radiation planning and supportive care based on the specific immunotherapy agent and its known interactions with radiation is a direct contravention of the principle of evidence-based practice and patient-specific care mandated by accreditation bodies. Professional reasoning. Professionals should approach combined modality treatment by initiating a multidisciplinary tumor board discussion or consultation early in the treatment planning process. This involves reviewing the patient's diagnosis, staging, and overall health status, followed by a detailed discussion of the proposed systemic therapy and its timing relative to radiation. The radiation oncologist should then assess the potential for overlapping toxicity. Consider modifications to the radiation plan, e.g., dose, fractionation, field arrangement, and establish clear communication channels with the medical oncologist for ongoing patient monitoring and management of side effects. This systematic, collaborative, and evidence-informed process ensures adherence to accreditation standards and prioritizes patient safety and optimal therapeutic benefit. Question 6. The evaluation methodology shows a radiation oncology department's quality assurance program documentation, which includes records of radiation measurements for treatment planning. A review of these records reveals a consistent use of the Sievert SV unit when specifying the prescribed dose to the patient's tumor. Based on ACR radiation oncology accreditation requirements, what is the most appropriate interpretation of this finding? Option A. The use of Sievert for prescribed tumor dose is a deviation from standard practice and ACR requirements, which mandate the use of Gray-Jai for absorbed dose in treatment prescription. Option B. The use of Sievert indicates a focus on biological risk assessment, which is a secondary but important aspect of radiation oncology that may be prioritized in some QA programs. Option C. The use of Sievert for prescribed tumor dose is acceptable if the radiation type is known to have a quality factor of 1, as it aligns with the concept of equivalent dose. Option D. The use of Sievert is a valid alternative to Gray for prescribed tumor dose, as both units measure the biological effect of radiation in a clinical setting. The correct answer is C. The use of Sievert for prescribed tumor dose is acceptable if the radiation type is known to have a quality factor of 1, as it aligns with the concept of equivalent dose. Explanation. The evaluation methodology shows a scenario where a radiation oncology department is undergoing accreditation, requiring a thorough understanding of radiation measurement units and their appropriate application. The professional challenge lies in ensuring that the chosen units accurately reflect the biological effect of radiation for treatment planning and patient safety, while adhering to ACR guidelines. Misapplication of units can lead to incorrect dose calculations, suboptimal treatment delivery, and potential harm to patients. The correct approach emphasizes the distinction between absorbed dose and equivalent dose. Gray-Jai measures the absorbed dose, which is the energy deposited per unit mass of tissue. Sievert SV measures the equivalent dose, which accounts for the biological effectiveness of different types of radiation. For photon and electron beams commonly used in radiation therapy, the quality factor is 1, meaning that 1 Jai of absorbed dose is equivalent to 1 SV of equivalent dose. However, understanding this distinction is crucial for situations involving different radiation types or when considering stochastic effects. Best professional practice, as guided by ACR accreditation standards, requires the use of Jai for specifying the prescribed dose to the target volume and for dose calculations, as this directly relates to the physical energy deposited. When discussing potential biological risk or comparing the effects of different radiation types, Sievert becomes relevant. An incorrect approach would be to exclusively use sievert for specifying the prescribed treatment dose. Now, this is a regulatory and ethical failure because the primary unit for prescribing and delivering radiation therapy dose in clinical practice, and as mandated by ACR, is Gray GI. While sievert is important for risk assessment and understanding biological impact, it is not the standard unit for treatment prescription. Another incorrect approach would be to confuse the two units or use them interchangeably without understanding their specific applications, leading to potential misinterpretations of dose and biological effect. This demonstrates a lack of fundamental knowledge required for safe and effective radiation oncology practice, which is a direct violation of accreditation standards. Professionals should approach such situations by first identifying the context of the measurement or prescription. For prescribed treatment doses and dose calculations, the standard is Gray. When evaluating the potential biological risk from radiation exposure, particularly in scenarios involving different radiation types or stochastic effects, the sievert unit is appropriate. A robust professional reasoning process involves consulting ACR guidelines, understanding the physical and biological implications of radiation, and ensuring clear and accurate communication of dose information to all stakeholders, including patients and other healthcare professionals. Question 7. The monitoring system demonstrates that a patient's prescribed daily dose for a course of external beam radiation therapy was inadvertently delivered at 95% of the planned fraction dose for 3 consecutive treatment days, with no immediate indication of machine malfunction. Which of the following represents the most appropriate immediate response and subsequent action to ensure compliance with American College of Radiology Radiation Oncology Accreditation standards? Option A. Document the deviation in the patient's chart and proceed with the treatment schedule as originally planned, without any attempt to compensate for the underdelivered dose or investigate the cause. Option B. Immediately investigate the cause of the underdelivery, including a review of patient setup, machine logs, and treatment parameters, and then develop a plan to compensate for the underdelivered dose while ensuring the total prescribed dose is delivered within acceptable limits and timeframes, or adjust the treatment plan as clinically indicated. Option C. Immediately inform the radiation oncologist and physicist of the deviation, and recommend a punitive review of the staff responsible for the treatment delivery without first investigating the root cause. Option D. Adjust the remaining fractions to deliver the cumulative underdelivered dose, assuming the deviation was a minor oversight, and proceeding with the original treatment schedule without further investigation or documentation. The correct answer is B. Immediately investigate the cause of the underdelivery, including a review of patient setup, machine logs, and treatment parameters, and then develop a plan to compensate for the underdelivered dose while ensuring the total prescribed dose is delivered within acceptable limits and timeframes, or adjust the treatment plan as clinically indicated. Explanation. Scenario analysis. This scenario presents a common challenge in radiation oncology accreditation, ensuring consistent and accurate adherence to prescribed fractionation and treatment schedules. Deviations, even minor ones, can impact treatment efficacy, increase toxicity, and compromise the overall quality of care. The professional challenge lies in identifying the root cause of the deviation and implementing corrective actions that not only address the immediate issue, but also prevent recurrence, all while maintaining patient safety and meeting accreditation standards. Correct approach analysis. The correct approach involves a thorough investigation into the cause of the deviation. This includes reviewing patient records, treatment planning data, machine logs, and staff protocols. Identifying whether the deviation was due to a planning error, a machine malfunction, a human error in setup or delivery, or a misunderstanding of the prescribed schedule is crucial. Once the cause is identified, appropriate corrective actions, such as replanning, machine calibration, staff retraining, or protocol revision, must be implemented. This systematic root cause analysis and corrective action process is fundamental to maintaining high-quality patient care and is a core expectation of accreditation bodies like the American College of Radiology, ACR. It directly aligns with the ACR's emphasis on quality assurance and continuous improvement in radiation oncology. Incorrect approach is analysis. Failing to investigate the root cause and simply adjusting the remaining fractions without understanding why the deviation occurred is a significant regulatory and ethical failure. This approach ignores the potential for systemic issues that could lead to further errors, jeopardizing patient safety and contravening the ACR's requirement for robust quality assurance programs. It demonstrates a lack of due diligence and a failure to uphold the highest standards of patient care. Assuming the deviation was a minor oversight and proceeding with the treatment schedule without any documentation or follow-up is also professionally unacceptable. This lack of documentation hinders future review, makes it impossible to track trends or identify recurring problems, and fails to meet the ACR's expectations for a comprehensive quality management system. It represents a failure in accountability and transparency. Implementing a punitive measure against the staff member without a thorough investigation into the cause of the deviation is an ethical failure and can create a negative work environment. Accreditation standards emphasize a culture of safety and continuous learning, not blame. Without understanding the systemic factors that may have contributed to the error, such measures are unlikely to prevent future occurrences and can discourage open reporting of issues. Professional reasoning. Professionals should approach such situations with a commitment to patient safety and quality. The decision-making process should be guided by a systematic approach. 1. Identify the deviation. 2. Immediately assess the potential impact on the patient. 3. Initiate a thorough root cause analysis involving relevant personnel and data. 4. Develop and implement targeted corrective and preventive actions. 5. Document all steps taken and outcomes. 6. Monitor for recurrence. This process ensures that deviations are not just corrected, but that the underlying issues are addressed, fostering a culture of continuous improvement essential for accreditation and excellent patient care. Question 8. The analysis reveals that a radiation oncology department's recent internal audit identified inconsistencies in the consistent and correct use of lead aprons and thyroid shields by radiation therapists during patient setup and treatment delivery, despite initial comprehensive training. The department is preparing for an upcoming American College of Radiology, ACR Radiation Oncology Accreditation Survey. Which of the following strategies best addresses this finding to ensure compliance and uphold best practices in radiation safety? Option A. Update the departmental policy manual to explicitly state the requirement for lead apron and thyroid shield use during all patient setup and treatment procedures, and distribute the updated policy via email to all staff. Option B. Rely on the initial training records to demonstrate compliance, assuming that the therapists understand the importance of PPE and will self-correct their practices over time. Option C. Implement a mandatory hands-on refresher training session for all radiation therapists focusing on the proper donning, doffing, and storage of PPE, coupled with a system of random, unannounced spot checks by the Radiation Safety Officer, RSO, to reinforce adherence and provide immediate corrective feedback. Option D. Address the issue by reminding staff during the next general staff meeting about the importance of PPE, emphasizing that minor deviations are generally acceptable as long as the primary treatment parameters are accurate. The correct answer is C. Implement a mandatory hands-on refresher training session for all radiation therapists focusing on the proper donning, doffing, and storage of PPE, coupled with a system of random, unannounced spot checks by the Radiation Safety Officer, RSO, to reinforce adherence and provide immediate corrective feedback. Explanation. The analysis reveals a common yet critical challenge in radiation oncology, ensuring consistent and effective implementation of personal protective equipment, PPE protocols amidst the dynamic nature of patient care and departmental workflow. This scenario is professionally challenging because it requires balancing patient safety, staff safety, regulatory compliance, and operational efficiency. The accreditation body, the American College of Radiology, ACR, places significant emphasis on radiation safety, which directly encompasses the appropriate use of PPE. Failure to adhere to established guidelines can lead to suboptimal radiation protection for staff, potentially impacting their long-term health, and can also signal systemic deficiencies in the department's safety culture, which is a core component of accreditation. The correct approach represents best professional practice because it prioritizes a proactive, evidence-based, and continuously improving safety culture. It involves a multifaceted strategy that includes regular training, clear policy development, and direct observation and feedback. This aligns with ACR accreditation standards that expect a robust radiation safety program, which inherently includes comprehensive PPE policies and their diligent execution. By actively assessing and reinforcing PPE use, the department demonstrates a commitment to the well-being of its staff and adherence to best practices in radiation protection, thereby meeting and exceeding accreditation expectations. An incorrect approach that relies solely on initial training without ongoing reinforcement is professionally unacceptable. This fails to acknowledge that knowledge retention can diminish over time and that adherence can wane without consistent oversight. The regulatory and ethical failure here lies in a potential breach of the duty of care owed to employees, as mandated by radiation safety regulations and ethical principles of occupational health. Another incorrect approach, focusing only on documented policy without practical verification, overlooks the reality that policies are only effective if they are understood and consistently applied. This creates a gap between stated intent and actual practice, which is a significant deficiency in a safety-critical environment and would likely be identified during an ACR survey. Finally, an approach that dismisses minor deviations as insignificant ignores the cumulative risk associated with radiation exposure and the principle of as low as reasonably achievable ALARA. Ethically and regulatorily, even minor lapses can contribute to unnecessary occupational dose and indicate a less than vigilant safety culture. Professional decision-making in such situations requires a systematic approach. First, recognize the importance of radiation safety as a cornerstone of accreditation and ethical practice. Second, understand that effective PPE utilization is not a one-time event but an ongoing process. Third, implement a comprehensive program that includes initial and recurring education, clear and accessible policies, regular audits of practice, and mechanisms for feedback and improvement. Fourth, foster a culture where safety is everyone's responsibility and where reporting concerns is encouraged without fear of reprisal. This proactive and integrated approach ensures that the department not only meets but embodies the principles of radiation safety required for ACR accreditation. Question 9. Operational review demonstrates a potential inconsistency in how radiation dose is perceived to be deposited in varying patient tissue densities during treatment planning. Which of the following approaches best aligns with the American College of Radiology Radiation Oncology accreditation requirements for understanding the interaction of radiation with matter? Option A. Attribute any perceived discrepancies in dose deposition solely to potential equipment malfunctions and initiate a broad equipment calibration schedule. Option B. Conduct a comprehensive review of the fundamental physics principles governing radiation matter interactions and their specific application within the facility's treatment planning and delivery systems, consulting with the medical physics team to ensure staff comprehension. Option C. Rely exclusively on historical treatment planning data and established protocols, assuming the underlying physics models are correctly implemented without further investigation. Option D. Primarily focus on analyzing patient treatment outcome data to identify any trends that might suggest dose deposition issues, without a direct reevaluation of the underlying physics. The correct answer is B. Conduct a comprehensive review of the fundamental physics principles governing radiation matter interactions and their specific application within the facility's treatment planning and delivery systems, consulting with the medical physics team to ensure staff comprehension. Explanation. Scenario analysis. This scenario presents a challenge in ensuring the consistent and accurate application of radiation therapy principles, specifically concerning the interaction of radiation with matter. The accreditation process by the American College of Radiology, ACR, emphasizes the need for robust quality assurance and a deep understanding of the underlying physics to ensure patient safety and treatment efficacy. A discrepancy in understanding how radiation interacts with different tissues can lead to suboptimal dose delivery, potential under- or overtreatment, and ultimately, compromised patient outcomes. The professional challenge lies in bridging the gap between theoretical knowledge of radiation matter interactions and its practical application in daily clinical workflows, ensuring all team members possess the necessary understanding. Correct approach analysis. The correct approach involves a comprehensive review of the physics principles governing radiation matter interactions, specifically focusing on how these principles are applied in the context of the ACR's radiation oncology accreditation standards. This includes understanding concepts like photoelectric effect, Compton scattering, and pair production, and how they influence dose deposition in various tissues and materials used in treatment planning and delivery. The ACR accreditation process requires demonstrated competency in these areas, ensuring that the clinical team can accurately predict and control radiation's behavior within the patient. A thorough review, potentially involving physics consultations and staff education, directly addresses the core requirements of the accreditation, ensuring that the facility's practices align with established best practices for radiation oncology. This proactive approach demonstrates a commitment to understanding and applying fundamental physics to optimize patient care and meet accreditation benchmarks. Incorrect approaches analysis, focusing solely on the clinical outcomes without addressing the underlying physics, is an insufficient approach. While patient outcomes are the ultimate goal, failing to understand the physics of radiation-matter interaction means the root cause of any potential issues in dose delivery may not be identified or corrected. This represents a failure to adhere to the ACR's emphasis on a strong scientific foundation for radiation oncology practice. Attributing discrepancies solely to equipment malfunction without considering the physics of interaction is also a flawed approach. While equipment issues can occur, the way radiation interacts with matter is a fundamental physical process that must be understood to accurately interpret any observed deviations. Ignoring this fundamental aspect can lead to misdiagnosis of problems and ineffective troubleshooting, failing to meet the ACR's requirement for a comprehensive understanding of treatment delivery. Relying exclusively on historical treatment planning data without re-evaluating the physics principles is problematic. Treatment planning systems are sophisticated tools, but their accuracy is predicated on accurate physical models. If there's a perceived discrepancy, a review of the underlying physics is crucial to ensure the models are correctly applied and understood by the staff, rather than assuming the historical data is inherently correct without critical evaluation against fundamental principles. This neglects the ACR's mandate for continuous learning and validation of practices. Professional reasoning. Professionals facing such a scenario should first acknowledge the potential for a gap in understanding fundamental physics principles as they relate to radiation oncology. The decision-making process should involve a systematic review of the ACR's accreditation requirements, specifically those pertaining to the physics of radiation therapy. This would entail consulting with the facility's medical physicist to identify areas of concern and to develop a targeted educational plan for the clinical team. The focus should be on understanding how radiation interacts with different tissues and materials encountered during treatment, and how these interactions are accounted for in treatment planning and delivery. This proactive and education-focused approach ensures that the team possesses the necessary knowledge to maintain high standards of patient care and to successfully meet accreditation requirements. Question 10. Research into radiation treatment planning at an ACR-accredited facility has revealed a situation where a patient, citing deeply held personal beliefs, requests a significant deviation from the standard, evidence-based treatment plan developed by the radiation oncology team. The requested deviation, while not immediately life-threatening, is projected to reduce the overall efficacy of the treatment and potentially increase the risk of local recurrence, according to established clinical guidelines and the facility's accreditation standards. The physician has thoroughly explained the rationale for the standard plan and the potential negative consequences of the requested deviation. What is the most ethically and professionally appropriate course of action for the physician in this scenario? Option A. Proceed with the patient's requested deviation after obtaining informed consent, ensuring thorough documentation of the discussion, the rationale for the deviation, and the patient's acknowledgement of the potential risks and reduced efficacy. Option B. Accede to the patient's requested deviation without further discussion or documentation, prioritizing patient satisfaction over adherence to established treatment protocols and accreditation guidelines. Option C. Develop a modified treatment plan that attempts to partially accommodate the patient's beliefs without fully adhering to the standard plan, without extensive multidisciplinary review or detailed documentation of the specific risks. Option D. Immediately dismiss the patient's request and insist on implementing the standard ACR-recommended treatment plan without further discussion, citing accreditation standards as the sole determinant of care. The correct answer is A. Proceed with the patient's requested deviation after obtaining informed consent, ensuring thorough documentation of the discussion, the rationale for the deviation, and the patient's acknowledgement of the potential risks and reduced efficacy. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the inherent tension between patient autonomy, physician responsibility, and the established standards of care within radiation oncology. The physician is faced with a patient who, due to personal beliefs, is requesting a treatment plan that deviates from the evidence-based, ACR-accredited standard, potentially compromising the efficacy and safety of the radiation therapy. Balancing respect for patient values with the imperative to provide optimal, evidence-based care, as mandated by ACR accreditation guidelines, requires careful ethical deliberation and communication. Correct approach analysis. The correct approach involves a thorough and empathetic discussion with the patient to understand the underlying reasons for their request. This includes exploring their beliefs, fears, and expectations regarding radiation therapy. The physician must then clearly explain the rationale behind the ACR-recommended treatment plan, detailing its evidence base, expected outcomes, and potential risks of deviation. If after this comprehensive discussion, the patient remains steadfast in their request, and the deviation does not pose an immediate, severe risk of harm that would violate fundamental ethical principles or ACR standards, the physician may consider developing an individualized plan, provided it is thoroughly documented, reviewed by a multidisciplinary team, and the patient provides informed consent acknowledging the deviation from standard practice and its potential consequences. This approach upholds patient autonomy while adhering to the spirit of ACR accreditation by prioritizing patient understanding, informed consent, and a documented, justifiable deviation from standard care when ethically permissible. Incorrect approaches analysis. One incorrect approach is to immediately dismiss the patient's request and insist on the standard ACR-recommended plan without further discussion. This fails to respect patient autonomy and can erode trust, potentially leading to patient noncompliance or seeking care elsewhere. It also neglects the opportunity to understand and address the patient's concerns, which is crucial for effective patient care and a cornerstone of ethical medical practice. Another incorrect approach is to accede to the patient's request without a thorough discussion of the risks and benefits, or without documenting the deviation and the rationale. This would violate the principles of informed consent and could lead to suboptimal treatment outcomes or adverse events, directly contravening the quality and safety standards expected of ACR-accredited facilities. It also bypasses the necessary multidisciplinary review that ensures patient safety and adherence to best practices. A third incorrect approach is to proceed with a modified plan that is not evidence-based or has not been adequately reviewed, simply to satisfy the patient's request. This risks providing substandard care, which is contrary to the core mission of ACR accreditation, which is to ensure high-quality, safe, and effective radiation oncology services. Such an approach could also expose the institution to liability and damage its reputation. Professional reasoning. Professionals should approach such situations by first prioritizing open and empathetic communication. Understanding the patient's perspective is paramount. This should be followed by a clear, evidence-based explanation of the recommended treatment plan, including its benefits and risks. If a patient's request deviates from the standard, the physician must assess the potential impact on treatment efficacy and patient safety. If the deviation is deemed ethically permissible and does not compromise fundamental care standards, a modified plan can be considered, but only with comprehensive informed consent, thorough documentation, and appropriate multidisciplinary review, aligning with the principles of patient-centered care and the quality assurance mandated by ACR accreditation. Question 11. Examination of the data shows a patient diagnosed with locally advanced prostate cancer who presents with a Gleason score of 9 and significant comorbidities that may affect tolerance to standard high-dose radiation therapy. The current ACR practice parameter for prostate cancer recommends a specific dose and fractionation schedule for definitive radiotherapy. The Multidisciplinary Tumor Board is reviewing the treatment plan. Which of the following approaches best aligns with the principles of ACR radiation oncology accreditation for this specific cancer site? Option A. The radiation oncologist proceeds with the standard ACR recommended dose and fractionation schedule, assuming the patient will tolerate it, and addresses any toxicity issues as they arise. Option B. The treatment planning process is significantly delayed as the team struggles to reconcile the patient's unique presentation with the existing ACR guidelines without a clear plan for resolving the discrepancy. Option C. The radiation oncologist proposes a modified dose and fractionation schedule based on the patient's comorbidities and a review of recent literature on dose escalation in similar patient populations, with a detailed justification documented for the entire team. Option D. The radiation oncologist decides to implement a novel, investigational brachytherapy technique not yet widely adopted or validated for this specific stage of prostate cancer, without prior consultation or peer review. The correct answer is C. The radiation oncologist proposes a modified dose and fractionation schedule based on the patient's comorbidities and a review of recent literature on dose escalation in similar patient populations, with a detailed justification documented for the entire team. Explanation: this scenario presents a common challenge in radiation oncology accreditation, ensuring adherence to established protocols for a specific cancer site while also considering individual patient factors and evolving clinical evidence. The American College of Radiology, ACR, Radiation Oncology Accreditation Program emphasizes standardized, evidence-based care to ensure quality and safety. The challenge lies in balancing the need for protocol adherence with the flexibility required to manage complex or unusual patient presentations. The correct approach represents best professional practice because it prioritizes a thorough, multidisciplinary review of the patient's case against established ACR guidelines and relevant clinical literature. This ensures that any deviation from standard protocols is well justified, documented, and understood by the entire treatment team. It aligns with the ACR's commitment to quality improvement and patient safety by promoting a systematic, evidence-based decision-making process. An incorrect approach that solely relies on physician preference without documented justification fails to meet the ACR's requirements for objective, evidence-based decision-making. This could lead to inconsistent care and potentially suboptimal outcomes, violating the principles of accreditation. Another incorrect approach that ignores established guidelines in favor of a novel technique without rigorous validation or peer review risks patient safety and deviates from the ACR's emphasis on proven methodologies. Finally, an approach that delays treatment planning due to an inability to reconcile patient specifics with guidelines, without a clear plan for resolution, can negatively impact patient prognosis and demonstrates a failure in efficient, quality-focused care delivery. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the patient's diagnosis and staging. This should be followed by a thorough review of relevant ACR practice parameters and current peer-reviewed literature for the specific cancer site. Any proposed deviations from standard protocols must be discussed within a multidisciplinary team, with clear documentation of the rationale, potential risks and benefits, and the expected outcome. This systematic approach ensures that patient care is both individualized and aligned with the highest standards of quality and safety mandated by accreditation bodies. Question 12. The performance metrics show a consistent, albeit small, increase in the average time required for patient setup verification across all treatment sites. Which of the following actions best represents a process optimization strategy aligned with ACR radiation oncology accreditation standards? Option A. Immediately hire additional personnel to expedite the patient setup verification process. Option B. Implement a directive to staff to reduce the time spent on each patient setup verification by a fixed percentage. Option C. Conduct a detailed workflow analysis of the patient setup verification process, including staff interviews and direct observation, to identify specific inefficiencies or bottlenecks. Option D. Defer action, as the observed increase in time is not significant enough to warrant immediate intervention. The correct answer is C. Conduct a detailed workflow analysis of the patient setup verification process, including staff interviews and direct observation, to identify specific inefficiencies or bottlenecks. Explanation: the performance metrics show a slight but persistent increase in the time taken for patient setup verification across all treatment sites within the radiation oncology department. This scenario is professionally challenging because it directly impacts patient throughput, potentially leading to longer wait times and reduced access to care, while also raising questions about the efficiency of established protocols. It requires careful judgment to identify the root cause and implement effective solutions without compromising the quality and safety of patient treatments, which are paramount under ACR accreditation standards. The correct approach which involves a systematic review of the current patient setup verification process, including staff interviews and observation, directly aligns with the ACR's emphasis on continuous quality improvement and adherence to established protocols. This method allows for the identification of specific bottlenecks or inefficiencies within the existing workflow. By engaging the staff who perform these tasks, the department can gather firsthand insights into potential challenges, such as equipment issues, unclear instructions, or inadequate training, which are all critical factors in maintaining compliance with regulatory standards for patient safety and treatment accuracy. This proactive, data-driven, and collaborative approach is best professional practice as it seeks to optimize processes in accordance with ACR guidelines for operational efficiency and patient care. An incorrect approach that focuses solely on increasing staffing levels without understanding the underlying process issues fails to address the root cause of the increased setup time. This could lead to unnecessary expenditure and may not resolve the problem, potentially masking deeper inefficiencies. Ethically and regulatorily, this approach is flawed because it does not demonstrate a commitment to optimizing existing resources or improving the quality of care through process refinement, a core tenet of ACR accreditation. Another incorrect approach, which involves implementing a blanket policy to rush the setup verification process, is highly problematic. This directly contravenes ACR standards that prioritize patient safety and treatment accuracy above all else. Rushing verification increases the risk of errors, such as incorrect patient positioning or treatment delivery parameters, which could lead to suboptimal outcomes or patient harm. This approach represents a significant regulatory and ethical failure by prioritizing speed over safety and quality. A third incorrect approach, which involves ignoring the performance metrics due to the perceived minor nature of the increase, is also unacceptable. ACR accreditation requires ongoing monitoring and improvement of all aspects of radiation oncology services. Failing to investigate and address even minor deviations from expected performance can lead to the gradual erosion of quality and safety standards. This passive approach demonstrates a lack of commitment to the continuous quality improvement mandated by regulatory bodies and professional organizations like the ACR. The professional decision-making process for similar situations should involve a structured approach. First, acknowledge and investigate performance data deviations. Second, engage relevant staff in a collaborative problem-solving effort. Third, analyze the process to identify root causes. Fourth, develop and implement targeted solutions. And finally, monitor the impact of these solutions to ensure sustained improvement and compliance with all applicable regulatory and accreditation standards. Question 13. To address the challenge of a radiation oncologist requesting a deviation from the standard treatment plan for a specific patient, citing a unique clinical scenario that they believe warrants a higher dose to a particular area, what is the most appropriate course of action to ensure adherence to the principles of radiation protection and accreditation standards? Option A. Politely decline the physician's request, stating that standard protocols must be followed without further discussion or investigation. Option B. Proceed with the requested deviation, but ensure it is documented in the patient's chart without involving other team members or a formal review. Option C. Initiate a formal review process involving the medical physicist and radiation oncology team to evaluate the proposed deviation against established protocols, safety guidelines, and the ALARA principle, documenting all findings and decisions. Option D. Immediately implement the physician's requested deviation to prioritize the physician's clinical judgment and perceived patient benefit. The correct answer is C. Initiate a formal review process involving the medical physicist and radiation oncology team to evaluate the proposed deviation against established protocols, safety guidelines, and the ALARA principle, documenting all findings and decisions. Explanation. Scenario analysis. This scenario presents an ethical dilemma common in radiation oncology accreditation, balancing patient safety with resource allocation and physician autonomy. The challenge lies in upholding the ALARA, as low as reasonably achievable, principle and established safety protocols when faced with a physician's request that deviates from standard practice due to perceived patient benefit, potentially without sufficient justification or adherence to established review processes. The accreditation body's framework emphasizes a systematic approach to patient care and safety, requiring evidence-based decision-making and adherence to institutional policies. Correct approach analysis. The correct approach prioritizes patient safety and adherence to established accreditation standards by initiating a formal review process. This aligns with the American College of Radiology, ACR, Radiation Oncology Accreditation Guidelines, which mandate that all treatment plans and deviations be reviewed by qualified personnel and documented. This process ensures that any departure from standard practice is scientifically justified, ethically sound, and minimizes unnecessary radiation exposure to the patient and staff, thereby upholding the ALARA principle. It also ensures that the institution's quality assurance program is functioning as intended. Incorrect approaches analysis. One incorrect approach involves immediately acceding to the physician's request without a formal review. This bypasses established safety protocols and quality assurance mechanisms, potentially leading to suboptimal treatment or unnecessary radiation exposure, violating the ALARA principle and ACR accreditation requirements for standardized, reviewed treatment planning. Another incorrect approach is to dismiss the physician's concern outright without investigation. This demonstrates a lack of respect for physician judgment and a failure to critically evaluate potential patient benefit, even if the request deviates from the norm. It also neglects the opportunity to refine existing protocols if the physician's concern highlights a genuine, albeit unusual, patient need. This approach fails to foster a culture of continuous improvement and patient-centered care, which are implicit in accreditation standards. A third incorrect approach is to implement the requested change without proper documentation or peer review. This undermines the integrity of the treatment planning process, making it impossible to track deviations, assess their efficacy, or ensure consistency in care. It also fails to meet ACR requirements for comprehensive documentation and quality control, leaving the institution vulnerable during accreditation surveys. Professional reasoning. Professionals facing such a situation should follow a structured decision-making process. First, acknowledge the physician's concern and the potential for patient benefit. Second, consult institutional policies and ACR guidelines regarding treatment plan deviations and physician requests. Third, initiate the established protocol for review, which may involve a physicist, dosimetrist, or radiation oncology committee, depending on the nature of the deviation. Fourth, ensure all discussions, decisions, and justifications are thoroughly documented. This systematic approach ensures patient safety, regulatory compliance, and ethical practice. Question 14. Analysis of a situation where a radiation oncology physicist identifies significant discrepancies between a physician's proposed treatment plan and established institutional quality assurance protocols during the plan evaluation phase. The physician, citing patient urgency, requests immediate approval, stating they will address the discrepancies after treatment initiation. What is the most appropriate course of action for the physicist to ensure patient safety and maintain compliance with American College of Radiology Radiation Oncology accreditation standards? Option A. Approve the plan with the physician's verbal assurance that the discrepancies will be corrected after treatment begins. Option B. Delay plan approval indefinitely until the physician provides a written explanation for the deviations, without further immediate communication or proposed resolution. Option C. Proceed with treatment as requested by the physician, assuming their clinical judgment supersedes the identified plan deviations. Option D. Document the discrepancies, communicate them clearly to the physician with a request for revision to meet all QA requirements before treatment, and if unresolved, escalate to the appropriate institutional oversight committee. The correct answer is D. Document the discrepancies, communicate them clearly to the physician with a request for revision to meet all QA requirements before treatment, and if unresolved, escalate to the appropriate institutional oversight committee. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a conflict between established quality assurance protocols and a physician's perceived urgency to initiate treatment. The physicist is tasked with upholding the integrity of the radiation oncology plan evaluation process, which is critical for patient safety and treatment efficacy, while also respecting the clinical judgment of the physician. The dilemma lies in balancing adherence to accreditation standards with the potential for delaying patient care, requiring careful consideration of both patient well-being and regulatory compliance. Correct approach analysis. The correct approach involves a structured, evidence-based resolution that prioritizes patient safety and adherence to the American College of Radiology, ACR Radiation Oncology Accreditation, ROA standards. This approach upholds the principle of independent verification, a cornerstone of quality assurance in radiation oncology. By documenting the discrepancies, communicating them clearly to the physician, and seeking resolution through established channels, e.g., peer review physicist consultation, the physicist ensures that the plan meets all required specifications before treatment commences. This aligns with ACR/ROA guidelines that mandate rigorous plan review and verification to prevent errors and ensure accurate dose delivery. The physicist's responsibility is to act as a gatekeeper for quality, ensuring that all plans are safe and accurate, thereby protecting the patient and maintaining the institution's accreditation status. Incorrect approaches analysis. One incorrect approach involves overriding the identified discrepancies and approving the plan based on the physician's assurance. This fails to uphold the ACR/ROA requirement for independent plan verification and quality assurance. It bypasses the critical safety checks designed to catch potential errors, thereby increasing the risk of patient harm due to incorrect dose delivery or treatment parameters. Ethically, it compromises the physicist's professional responsibility to patient safety. Another incorrect approach is to delay the plan approval indefinitely without clear communication or a defined path to resolution. While caution is warranted, an indefinite delay without a structured process for addressing the discrepancies can negatively impact patient care by unnecessarily postponing treatment. This approach fails to demonstrate a proactive and collaborative problem-solving effort, which is expected in a quality-assured environment. It also does not align with the spirit of efficient, yet safe, patient care that accreditation aims to foster. A third incorrect approach is to approve the plan with a verbal acknowledgement from the physician that the discrepancies will be addressed post-treatment. This is fundamentally flawed, as it allows treatment to commence with known deviations from the approved plan. The ACR/ROA standards require that plans be verified and approved before treatment begins. Post-treatment correction does not mitigate the risks associated with delivering an inaccurate or suboptimal dose during the initial treatment course. This approach directly violates the principle of prospective quality assurance. Professional reasoning. Professionals facing such dilemmas should first clearly identify and document all deviations from established protocols or expected standards. Next, they must communicate these findings objectively and professionally to the relevant parties, in this case, the treating physician. The communication should focus on the potential impact on patient safety and treatment efficacy. The professional should then propose a clear, actionable plan for resolution, referencing relevant guidelines or protocols. If consensus cannot be reached through direct communication, the professional should escalate the issue through established institutional channels, such as the physics department chair, radiation safety officer, or a quality assurance committee, to ensure a fair and thorough review. The ultimate goal is to achieve a resolution that prioritizes patient safety and adheres to regulatory requirements. Question 15. The evaluation methodology shows a discrepancy in the contouring of a critical organ at risk adjacent to a primary tumor, where one team member has delineated the structure significantly larger than another, potentially impacting dose constraints. What is the most appropriate course of action to ensure compliance with American College of Radiology Radiation Oncology accreditation standards? Option A. Accept the contour provided by the most senior physician on the team, as their experience is presumed to lead to the most accurate delineation. Option B. Proceed with the contour that appears most conservative in terms of organ at risk volume, assuming this will inherently protect the structure better. Option C. Re-image the patient using a different modality to see if the organ at risk contour changes, without first establishing a consensus on the current imaging. Option D. Convene a multidisciplinary team meeting to review the imaging and collaboratively establish a consensus contour for the organ at risk, referencing established ACR guidelines and anatomical landmarks. Correct answer is D. Convene a multidisciplinary team meeting to review the imaging and collaboratively establish a consensus contour for the organ at risk, referencing established ACR guidelines and anatomical landmarks. Explanation. The evaluation methodology shows a scenario where a radiation oncology team is tasked with contouring a complex tumor and adjacent organs at risk for a patient undergoing treatment. This is professionally challenging because accurate contouring directly impacts dose delivery, potentially leading to undertreatment of the tumor or overtreatment of critical OARs, both of which have significant clinical consequences. The ACR Radiation Oncology Accreditation Program emphasizes the importance of precise and consistent contouring as a cornerstone of quality patient care. The correct approach involves a systematic, consensus-driven process that adheres strictly to established ACR guidelines and best practices for contouring. This includes utilizing appropriate imaging protocols, leveraging advanced visualization tools, and ensuring that all team members involved in contouring, physicians, dosimetrists, physicists, have a shared understanding of the target volumes and OARs based on anatomical landmarks and clinical consensus. This approach represents best professional practice because it prioritizes patient safety and treatment efficacy by minimizing inter-observer variability and ensuring that contouring decisions are well documented and justifiable according to accreditation standards. It directly aligns with the ACR's commitment to maintaining high standards in radiation oncology. An incorrect approach would be to rely solely on the interpretation of a single individual, without peer review or adherence to established contouring atlases or protocols. This fails to meet the ACR accreditation requirements for quality assurance and consistency in treatment planning. Another incorrect approach is to contour based on assumptions about tumor biology or expected treatment response, without clear anatomical delineation, which introduces subjectivity and deviates from the objective, evidence-based requirements of accreditation. A further incorrect approach is to contour OARs in a manner that prioritizes tumor coverage at the expense of critical structures, without a documented rationale or adherence to dose constraints, which violates ethical principles of patient care and regulatory expectations for OAR management. Professionals should approach contouring by first thoroughly reviewing the patient's imaging, understanding the specific tumor site and its relationship to surrounding OARs. They should then consult relevant ACR contouring guidelines and any site-specific protocols. Engaging in a collaborative contouring session with the multidisciplinary team, where consensus is reached on critical structures and target volumes, is crucial. Any discrepancies should be resolved through discussion and documented. This systematic and collaborative process ensures that contouring is accurate, reproducible, and compliant with accreditation standards, ultimately benefiting patient outcomes. Question 16. The assessment process reveals that a patient undergoing radiation therapy for a localized prostate cancer, initially treated according to an established protocol, has a new research publication suggesting a potentially superior dose escalation strategy for similar tumor characteristics, which could improve local control rates. The patient has tolerated the current treatment well thus far. Considering the ACR Radiation Oncology Accreditation Guidelines, what is the most appropriate next step for the radiation oncology team? Option A. Continue with the current treatment plan as established, as it is already accredited and has been tolerated well by the patient, without further investigation into the new research. Option B. Inform the patient that the current treatment is adequate and that exploring new research findings is not part of the standard accreditation process for ongoing treatments. Option C. Immediately alter the treatment plan to incorporate the dose escalation strategy described in the new research to maximize potential benefits for the patient. Option D. Initiate a multidisciplinary team review to evaluate the new research, discuss its applicability to the patient's specific case, and determine if a modification to the current treatment plan is warranted, ensuring all decisions are documented and communicated to the patient. The correct answer is D. Initiate a multidisciplinary team review to evaluate the new research, discuss its applicability to the patient's specific case, and determine if a modification to the current treatment plan is warranted, ensuring all decisions are documented and communicated to the patient. Explanation. The assessment process reveals a critical juncture in patient care where the established treatment plan for a patient with a specific type of cancer is being questioned due to emerging research and patient-specific factors. This scenario is professionally challenging because it requires balancing established protocols, the principle of beneficence acting in the patient's best interest, and the need to stay abreast of evolving medical knowledge, all within the stringent framework of ACR Radiation Oncology Accreditation Guidelines. The accreditation process emphasizes adherence to evidence-based practices and continuous quality improvement, making the decision-making process for treatment modification particularly sensitive. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary review of the patient's case in in light of new information. This aligns with ACR guidelines that mandate a systematic approach to treatment planning and delivery, including regular review and adaptation based on patient response and evolving scientific understanding. It upholds the ethical obligation to provide the highest standard of care by ensuring that the treatment plan remains optimal and evidence-based. This approach fosters a culture of safety and quality, central to the ACR's accreditation mission. An incorrect approach that relies solely on the initial treatment plan without considering new evidence fails to meet the ACR's expectation for continuous quality improvement and adherence to current best practices. This could lead to suboptimal patient outcomes and a failure to provide the most effective treatment available, violating the principle of beneficence. Another incorrect approach that unilaterally alters the treatment plan based on anecdotal evidence or without proper multidisciplinary consultation disregards the systematic and evidence-based decision-making processes required by ACR accreditation. This can introduce new risks and compromise the integrity of the treatment, potentially leading to adverse events and a breach of professional responsibility. A third incorrect approach that dismisses the new research without a thorough evaluation risks perpetuating outdated or less effective treatment modalities, which is contrary to the spirit of advancing radiation oncology care as promoted by ACR accreditation. Professionals should employ a decision-making framework that involves 1. Acknowledging and critically evaluating new information, research, clinical data. 2. Convening the multidisciplinary team, physician, physicist, dosimetrist, nurse, etc., to discuss the implications of the new information in the context of the specific patient's case. 3. Assessing the potential benefits and risks of modifying the current treatment plan versus continuing it. 4. Documenting the decision-making process and the rationale for any changes made. 5. Communicating clearly with the patient and obtaining informed consent for any modifications. This systematic process ensures that decisions are evidence-based, patient-centered, and compliant with accreditation standards. Question 17. What factors determine the appropriateness of radiation therapy as a primary treatment modality for a patient with early-stage lung cancer and significant pre-existing cardiac disease? Option A. The patient's overall performance status, the specific stage and histology of the lung cancer, the potential for local control with radiation, and the predicted toxicity profile considering their cardiac comorbidities. Option B. The availability of advanced radiation delivery techniques, even if the potential benefit is marginal compared to the risks. Option C. The physician's personal experience with similar cases in the past, without consulting current clinical guidelines. Option D. The patient's chronological age and their expressed desire to avoid surgery, regardless of other medical factors. The correct answer is A. The patient's overall performance status, the specific stage and histology of the lung cancer, the potential for local control with radiation, and the predicted toxicity profile considering their cardiac comorbidities. Explanation. This scenario presents a common clinical challenge in radiation oncology, determining the appropriate role of radiation therapy for a patient with a complex medical history and a potentially curable malignancy. The challenge lies in balancing the potential benefits of radiation therapy against its risks, especially in a patient with comorbidities that could increase treatment toxicity. Adherence to the American College of Radiology, ACR, radiation oncology accreditation standards is paramount, requiring a thorough, evidence-based, and patient-centered approach to treatment planning. The correct approach emphasizes a multidisciplinary evaluation and consideration of established clinical guidelines and evidence. This aligns with ACR accreditation requirements that mandate a systematic and documented process for patient selection and treatment planning, ensuring that radiation therapy is indicated based on the tumor's characteristics, the patient's overall health, and the potential for cure or palliation with acceptable toxicity. It reflects best professional practice by prioritizing patient safety and maximizing therapeutic benefit through informed decision-making. Incorrect approaches fail to meet these standards. Focusing solely on the patient's age without a comprehensive assessment of their functional status and comorbidities ignores the nuanced criteria for radiation therapy indication and can lead to undertreatment or overtreatment. Similarly, prioritizing a single physician's opinion without engaging in a multidisciplinary discussion or consulting relevant literature and guidelines violates the principle of evidence-based medicine and can result in suboptimal care. Relying on anecdotal evidence or past personal experience without current validation is also a failure, as medical knowledge and treatment paradigms evolve. These approaches risk violating ACR accreditation standards by not demonstrating a systematic, evidence-based, and patient-specific justification for treatment decisions. Professional decision-making in such situations requires a structured approach. First, a thorough review of the patient's medical history, imaging, pathology, and performance status. Second, consultation with relevant specialists, e.g., medical oncology, surgery, to discuss the patient's overall management plan. Third, a critical appraisal of current evidence-based guidelines and literature pertaining to the specific cancer type and stage. Finally, a shared decision-making process with the patient, ensuring they understand the risks, benefits, and alternatives to radiation therapy. Question 18. The efficiency study reveals that the current quality assurance procedures for photon therapy are being applied to electron beam therapy without modification. Considering the distinct physical properties of these radiation types, which of the following represents the most appropriate risk assessment approach to ensure compliance with American College of Radiology Radiation Oncology Accreditation standards? Option A. Continue using the existing photon therapy quality assurance procedures for electron beams, assuming that minor adjustments in energy settings are sufficient to compensate for differences. Option B. Streamline the quality assurance process for electron beams by reducing the frequency of certain checks, given the perceived lower complexity compared to photon therapy. Option C. Focus quality assurance efforts primarily on the treatment planning system's output for electron beams, as this is the most critical component for accurate dose delivery. Option D. Implement modality-specific quality assurance protocols that account for the unique depth dose characteristics and energy deposition patterns of electron beams, including tailored calibration and verification methods. The correct answer is D. Implement modality-specific quality assurance protocols that account for the unique depth dose characteristics and energy deposition patterns of electron beams, including tailored calibration and verification methods. Explanation. The efficiency study reveals a discrepancy in the quality assurance protocols for different radiation modalities. This scenario is professionally challenging because it requires a deep understanding of the fundamental physics of radiation types and their implications for patient safety and treatment efficacy, as well as a thorough knowledge of ACR radiation oncology accreditation requirements. The accreditation body mandates rigorous quality assurance for all treatment modalities, and failing to account for the distinct physical properties of electromagnetic and particle radiation can lead to suboptimal or even unsafe practices. The correct approach involves recognizing that electromagnetic radiation, photons, and particle radiation, electrons, protons, etc., interact with tissue differently due to their distinct physical characteristics, mass, charge, energy deposition patterns. Electromagnetic radiation typically has a more uniform depth dose profile, while particle radiation, particularly protons, exhibits the Bragg peak phenomenon, allowing for precise dose sculpting and reduced exit dose. Therefore, quality assurance procedures must be tailored to these differences. For instance, beam calibration, dose verification, and imaging protocols may need distinct methodologies to accurately assess and deliver the prescribed dose for each radiation type. Adhering to ACR guidelines, which emphasize modality-specific QA, ensures that the unique advantages and challenges of each radiation type are addressed, leading to optimal patient outcomes and compliance. An incorrect approach would be to apply a single, generalized quality assurance protocol to both electromagnetic and particle radiation without considering their fundamental differences. This fails to acknowledge the Bragg peak characteristic of particle radiation, potentially leading to under- or overdosing at specific depths. It also overlooks the distinct calibration and monitoring requirements for different radiation types, which are implicitly or explicitly addressed in accreditation standards that aim for comprehensive quality management. Another incorrect approach would be to prioritize efficiency over accuracy in QA, assuming that a faster, less detailed process is acceptable. This directly contradicts the core principles of radiation oncology accreditation, which prioritize patient safety and treatment precision above all else. Furthermore, neglecting to document and justify any deviations from standard QA procedures for specific modalities would be a significant regulatory failure, as accreditation requires transparency and accountability in all quality processes. Professionals should approach such situations by first identifying the specific radiation modality being used. Then, they must consult the relevant ACR radiation oncology accreditation standards and guidelines, paying close attention to any modality-specific requirements for quality assurance. A thorough understanding of the physics of each radiation type is crucial for interpreting these guidelines and implementing appropriate QA measures. This involves a systematic review of calibration procedures, dose verification techniques, imaging protocols, and treatment planning system validation, ensuring that each is optimized for the specific radiation being delivered. When faced with a discrepancy, the decision-making process should involve a multidisciplinary team, including physicists, dosimetrists, and radiation oncologists, to collaboratively determine the most appropriate and compliant course of action, prioritizing patient safety and treatment integrity. Question 19. Regulatory review indicates that a radiation oncology department is preparing to install a new, state-of-the-art linear accelerator. Which of the following approaches best ensures compliance with American College of Radiology radiation safety and protection standards for this transition? Option A. Begin patient treatments immediately upon installation, relying on the manufacturer's basic operational manual and assuming existing safety protocols are sufficient. Option B. Conduct a thorough, site-specific risk assessment and develop updated safety protocols and comprehensive staff training programs prior to the first patient treatment on the new unit. Option C. Assume that all radiation safety protocols developed for previous linear accelerators are directly applicable to the new equipment without specific re-evaluation. Option D. Postpone a comprehensive radiation safety review until several months into clinical operation, allowing any emergent issues to be identified through routine use. The correct answer is B. Conduct a thorough, site-specific risk assessment and develop updated safety protocols and comprehensive staff training programs prior to the first patient treatment on the new unit. Explanation. Scenario analysis. This scenario presents a common challenge in radiation oncology accreditation, ensuring consistent and effective radiation safety practices across a department, particularly when new equipment or protocols are introduced. The professional challenge lies in balancing the need for rapid implementation of advanced technology with the paramount importance of patient and staff safety, as mandated by ACR guidelines. It requires a proactive and systematic approach to risk assessment and mitigation, rather than a reactive one. Correct approach analysis. The correct approach represents best professional practice because it aligns directly with the principles of radiation safety and quality assurance emphasized by the American College of Radiology, ACR. ACR accreditation standards require a comprehensive radiation safety program that includes regular review, evaluation, and updating of policies and procedures. Implementing a new linear accelerator necessitates a thorough pre-implementation risk assessment, development of specific safety protocols, and comprehensive staff training. This ensures that all personnel are competent in operating the new equipment safely, and that potential hazards are identified and controlled before patient treatments commence. This systematic approach minimizes the risk of errors, accidental exposures, and ensures compliance with all relevant ACR guidelines for radiation oncology. Incorrect approaches analysis. One incorrect approach involves proceeding with patient treatments immediately after installation, relying solely on the manufacturer's basic operational training. This is a significant regulatory and ethical failure because it bypasses the critical step of site-specific risk assessment and protocol development. ACR standards require that the facility's radiation safety officer, RSO, and relevant staff actively participate in developing and approving safety procedures tailored to the specific clinical environment and equipment. This approach neglects the responsibility to ensure that the new technology is integrated safely into existing workflows and that potential unique risks are addressed. Another incorrect approach is to defer the comprehensive safety review until after the first few months of operation, assuming that any issues will become apparent during routine use. This is a failure to adhere to proactive safety management principles. ACR accreditation emphasizes a culture of safety that prioritizes prevention over remediation. Waiting for problems to arise increases the likelihood of adverse events, compromises patient care, and demonstrates a lack of commitment to established quality assurance processes. It also fails to meet the ACR's expectation for robust preoperational safety checks. A third incorrect approach is to assume that existing radiation safety protocols for older equipment are fully transferable to the new linear accelerator without specific evaluation. While some principles may overlap, modern linear accelerators often have different safety features, interlocks, and operational nuances. This approach risks overlooking new potential hazards or failing to leverage enhanced safety mechanisms of the new technology. It is a failure to conduct a thorough, equipment-specific safety evaluation as required by best practices and ACR guidelines, potentially leading to noncompliance and increased risk. Professional reasoning. Professionals should adopt a systematic, risk-based approach to the introduction of new radiation oncology equipment. This involves 1. Early engagement of the RSO and clinical physics team in the procurement and planning phase. 2. Conducting a detailed pre-implementation risk assessment specific to the new equipment and its intended use. 3. Developing and documenting site-specific safety protocols and emergency procedures. 4. Implementing comprehensive hands-on training for all relevant staff, including physicists, dosimetrists, therapists, and physicians, focusing on both routine operation and potential failure modes. 5. Performing thorough preclinical testing and quality assurance checks before the first patient treatment. 6. Establishing a mechanism for ongoing monitoring and evaluation of safety performance post-implementation. This structured process ensures that patient and staff safety remains the highest priority, in full alignment with ACR accreditation requirements. Question 20. Compliance review shows that during a recent unscheduled radiation beam interruption in a treatment room, a significant amount of radioactive material was detected outside the primary shielding. What is the most appropriate immediate course of action to ensure compliance with American College of Radiology Radiation Oncology Accreditation emergency procedures? Option A. Attempt to identify the source of the leak and assess the extent of contamination before initiating any containment measures. Option B. Initiate a full internal investigation into the cause of the leak before reporting it to any external parties. Option C. Continue with scheduled patient treatments in adjacent rooms while monitoring the situation closely. Option D. Immediately evacuate all personnel from the affected area and adjacent rooms. Secure the area to prevent unauthorized entry and notify the Radiation Safety Officer, RSO, and designated emergency contacts. Correct answer is D. Immediately evacuate all personnel from the affected area and adjacent rooms, secure the area to prevent unauthorized entry, and notify the Radiation Safety Officer, RSO, and designated emergency contacts. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because it requires immediate and decisive action in a high-stress, potentially dangerous environment. The primary challenge lies in balancing the need for rapid response to contain a radiation incident with the imperative to ensure the safety of personnel and the public, while also adhering to strict accreditation standards. Misjudgment can lead to significant harm, regulatory noncompliance, and erosion of public trust. Correct approach analysis. The correct approach prioritizes immediate containment and notification, as mandated by the American College of Radiology, ACR, Radiation Oncology Accreditation Standards for Emergency Preparedness. Promptly securing the affected area prevents further exposure and contamination, while immediate notification to the Radiation Safety Officer, RSO, and relevant authorities initiates the established emergency response protocol. This aligns with the ACR's emphasis on robust safety procedures and rapid incident management to minimize risk and ensure a coordinated, effective response. Incorrect approaches analysis. One incorrect approach involves attempting to manage the incident solely with on-site personnel, without immediate external notification. This fails to leverage specialized expertise and resources available through the RSO and external agencies, potentially delaying critical containment and remediation efforts, and violating ACR guidelines that require clear lines of communication and escalation during emergencies. Another incorrect approach is to prioritize patient treatment continuity over immediate incident containment. While patient care is paramount, continuing treatment in a compromised environment could expose more individuals to radiation, exacerbating the incident and creating a more severe safety and regulatory breach. ACR standards emphasize that safety protocols must be enacted without delay during an incident. A third incorrect approach is to delay reporting the incident until a full assessment of the damage is completed. This delay is a direct violation of emergency reporting requirements. ACR accreditation mandates prompt reporting to facilitate swift intervention and prevent escalation, underscoring the principle that timely communication is a cornerstone of effective emergency management. Professional reasoning. Professionals facing such a situation should employ a decision-making framework that begins with immediate threat assessment and activation of predefined emergency protocols. This involves prioritizing safety, containment, and communication in that order, understanding the specific roles and responsibilities outlined in the facility's radiation emergency plan, as well as the reporting requirements stipulated by the ACR, is crucial. Regular drills and training are essential to ensure that staff can execute these protocols effectively under pressure, demonstrating a commitment to patient and staff safety that is fundamental to ACR accreditation.